not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. Joining us for today's media briefing are Governor Tony Evers and DHS Deputy Secretary Julie Willems Van Dyke. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestone, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Thank you so much, and good afternoon, and thank all of you for joining us today. Wisconsinites from Superior to Milwaukee are ready and anxious to get vaccinated and get back to our Wisconsin way of life. And that's what's great, because that's exactly how we're going to kick this pandemic to the curb. That's why earlier this week, we moved into phase 1B of our vaccination program, starting with our first responders like our law enforcement, EMS, and firefighters who are helping keep our communities safe. And we also announced that on Monday, Wisconsinites 65 and older will be eligible to receive the vaccine. Now, this is great news and will help save lives in one of the populations we know is particularly vulnerable to the severe effects of the virus. But folks, here in Wisconsin, that's not a small group. There are approximately 700,000 Wisconsin residents 65 and older. The amount of vaccine we get from the federal government will help determine how quickly we can get through this group, but we're going to get started with the supplies we have available now. So we encourage Wisconsinites who are 65 or older to connect with their primary care provider or find more information on the DHS website. To get through 700,000 Wisconsinites is going to take some time, but our healthcare partners, pharmacies, and local and tribal public health folks are ready and up to the task to get as many people, get to as many people as possible, as quickly and safely as possible. Folks, this is the largest vaccination rollout in our state's history, and not only is it a rapidly evolving situation, there are a lot of moving parts moving very quickly. We continue prioritizing, distributing, and administering the vaccine in a safe, efficient, fair, and transparent way. So I encourage Wisconsinites to continue to tune into these briefings and the DHS's vaccine briefings to learn more about this process and to check out the DHS website for the most up-to-date vaccination information. In the meantime, we'll continue to make the most of the supplies we have and continue our response with the tools we have today. From at-home testing and our community testing sites to staying home, wearing masks, and avoiding social gathering, let's continue to double down on the efforts we know can and will save lives, and let's get through this pandemic, Wisconsin. Finally, today, I want to take a moment to thank Andrea Pound. As many of you know, Andrea has accepted a position with the Biden administration as a Deputy Secretary of the U.S. Department of Health and Human Services. She has been an absolutely critical part of our administration and has done an extraordinary job leading our state throughout the pandemic. We're thrilled for her as she leaves us to take on this new opportunity to serve our country, just as she has our state, with empathy, kindness, and tenacity. For the time being, our team at the DHS will continue leading our state's response, including Deputy Secretary Julie Willems Van Dyke, who is with us today. And I also announced that I have appointed Karen Timberlake to serve as the interim secretary at DHS. Karen has led the department before from 2008 to 2011, including during the 2009 H1N1 pandemic. She will bring a wealth of experience and knowledge to the role, and I have no doubt she will be able to hit the ground running at DHS to continue our state response. So with that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dyke. Take it away, Julie.
Thank you, Governor, and good afternoon, and thank you all for joining us. Earlier this week, we expanded COVID-19 vaccine eligibility to include Wisconsinites age 65 and older, as the governor has just said. This expansion protects those who have suffered dire consequences of the pandemic, as 87% of Wisconsin's total deaths were in people age 65 or older. Today, after examining the almost 5,000 public comments that the State Disaster Medical Advisory Committee received, that group made their recommendations for additional populations to include in Phase 1B. DHS looks forward to receiving those formal recommendations and will make a determination on these populations very soon. Taken all together, our healthcare workers, first responders, staff and residents at nursing homes who are in the process of getting vaccinated, staff and residents at assisted living facilities whose vaccinations have already begun and will begin even more fully on Monday, our 65-year-old and older neighbors, friends, and family members who are now eligible, and all of the new groups recommended by our advisory committee. All together, we're talking about 45% of our state's adult population. That is a lot of people. It's about 2 million people. And as the governor has said, we don't yet have enough vaccine for all those folks because we are still not getting enough of it from the federal government on a weekly basis. Each week, we receive approximately 70,000 first dose vaccines. And we understand, based on conversations with the federal government, that our supply will remain at this level for at least the next 3 to 4 weeks. This is going to take time. This Tuesday, when we announced the eligibility expansion for adults 65 and older, we also asked for patience. And I know that is not what we want to hear. Being patient is not easy. And after almost a year of this pandemic, I know that asking for more patience is, frankly, a lot to ask. So today, I'm going to ask for something a little bit different. Today, we're asking for perseverance because being patient can feel frustrating and powerless. But perseverance is about continued effort and persistence in the face of challenges. Yes, many of us still need to wait before we get the COVID-19 vaccine, myself included. But while we do that, we need to persevere by continuing our effort to stop the spread, because the vaccine is a valuable tool and we are grateful to have it and grateful to be rolling it out as quickly and equitably as we can. And at the same time, we need to continue using all our other tools we have used to fight this pandemic. We need to stay home and limit our interactions to only the people we live with. We need to wash our hands frequently. We need to mask up when we go out for essentials and make sure we practice physical distancing. And please, this is very important. If you have symptoms of COVID-19 or have been exposed to someone who has tested positive, please get tested yourself. Call your healthcare provider or visit one of our community testing sites or order an at-home collection kit. You can find out more about all of these options by going to our testing site, dhs.wisconsin.gov/testing. Remember to quarantine as you wait for your results and to monitor for symptoms if you receive a negative result. In Wisconsin, 285,358 vaccines have been administered to date. That's great news. And what's even better news is that 22,072 of those doses were reported in the last 24 hours, making it our single largest day of vaccination so far. 51,893 of those doses are second doses, meaning those recipients have completed their vaccine series and are fully protected. And as we've talked about, the pandemic rages on. We are adding 2,177 new cases today, which brings our total confirmed cases of COVID-19 to 528,101. Our 7-day average of new cases is 1,731. Today, we are reporting 45 more Wisconsinites who have lost their life to COVID-19, which brings our total deaths to 5,607. Our thoughts are with the families and friends who have lost their precious loved ones. So we must remember that staying home and masking up and getting tested if you need to are the tools that we know work to stop the spread and ultimately save lives. Thankfully, we've added another tool with the vaccine, but we need to keep working with the entire toolbox as we ramp up vaccination over the coming months, because it will take months, but we will persevere and get through this. Thank you, and we look forward to taking your questions.
And thank you. And a reminder to maintain audio quality, to please keep phones on mute until it is time to ask your question. And remember, *6 mutes and unmutes your phone. And in the interest of time, please one question per reporter per outlet. And we'll begin this afternoon with Denise Lockwood from Racine County. Denise?
Good afternoon. My question is around, now that we've been in this phase of dealing with COVID for over a year, what do we know about the data around the long-term impact on people's health who end up getting COVID?
That's a great question, Denise, and I'd love to turn to Dr. Westergaard to comment on that.
Sure. For the very large majority of people who develop this infection, it is what we call an acute or self-limited infection. So the very large majority, high 90% of people will have their symptoms fully resolved within about 2 weeks. And even before that, will resolve the active infection where they're no longer infectious. We've learned that there are rare cases where people have something that resembles chronic fatigue or soreness or muscle soreness that can go on for a period of time. That seems relatively rare. We haven't fully described that phenomenon, but it's not unusual with a number of infections that stimulate a large immune system response to have some symptoms that can linger for some time. So I think there's still things need to be learned from the research, but I think it's fair to say that the very, very large majority of people who recover from this infection fully recover.
Thank you, Denise. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks again for doing this call. Governor, the supply of vaccine aside, are you satisfied with the way with the job the state has done in disseminating the vaccine that has come in hand? And in your opinion, is there anything that could be done better?
No, I think we rely on our partners across the state of Wisconsin, the hospitals, the healthcare folks that are actually doing the work, and so I think we're doing as best as we can, considering the ramifications of the vaccines and the number of vaccines. Now that said, we continue and we will continue to alter operations as we see fit and as the committee gives us information. So the things will become even more clear as we move forward. The beginning was a little bumpy because of the rollout and the lack of vaccine, and that still is going to be the case. But I know people are real interested in knowing exactly when they can get this vaccine, and unfortunately we can't guarantee it. But our vaccinators across the state now, it took them a while to get geared up too, frankly. And I had the opportunity to be with Dr. Rye from Purveyor up in Green Bay this week, and they put together a great facility at the University of Wisconsin Green Bay, and they're serving people today. And they met their goal that day, and the next day or the day after, I was talking to Dr. Rye, and he was over in Eau Claire, opening up a community site there. And so I know it's going faster than it did to begin with, but it took a while for us to approve folks that were going to do the vaccinating, and also obviously it takes time for them to get their facilities ready. So could things have gone better? I suppose by a day or two if everything worked perfectly, but at the end of the day, we're driven by how many shots we have to put into people's arms.
Thank you, Scott. Now to Heather Poltrock from WSAW TV in Wausau. Heather.
Thank you. Everyone's continually said that we need more vaccine. Could someone just share what the root of that issue is, why we don't have what we need? Is it manufacturing, transportation, training?
Well, I'll just jump in and let others correct me if I'm not saying it appropriately. But if they're not making enough, that is the beginning. That is the problem, or frankly, overpromise from the federal government. As everybody knows, a couple of weeks ago, I was with Vice President Pence, and he was talking about they were going to release a stockpile to the states. Well, there was, as it turns out, no stockpile to release. So it has to be ramped up. Does it take a while for vaccinators to get their facilities ready and to get the way that people are going to sign up ready, the registration ready? All those things take time, but at the end of the day, if we're still fighting over needing 3 times as much as we have now, that's a production problem. And I know the president has talked about using the National Defense Act to ramp that up. But the sooner we get more vaccines, the quicker we have doing the job that we need to do. And in addition, it takes time for those that are doing the vaccinating to be ready. I think, and Julie will know this number better than me, but the number of people that are vaccinators, groups that are vaccinators, almost doubled over the last couple of weeks. So we're moving in the right direction, but the bottom line is you have to have vaccine in order to vaccinate.
Thank you, Heather. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben?
Hi there, thank you. This question is more so for Deputy Secretary Van Dyke. What's your response to SDMAC's recommendation to sub-prioritize educators and child care workers?
So let me first say this about the SDMAC. I want to extend our great appreciation for the work that they have done. This is a group of volunteers who have put hours and hours into studying the ramifications of the decisions they're making, to think thoughtfully around the ethical and scientific principles they use to make their decisions, who have read 5,000 comments from the public and carefully considered those, who have had many people contacting them directly, sometimes not always with the greatest kindness. And so I just want to, first of all, extend my great appreciation to Dr. Westergaard and to Dr. Hamadani, who chaired the committee, and to all of the members who have worked so diligently. We all owe them a debt of gratitude. So we're very excited to receive the final recommendations and to delve into them. You know, as we think about educators, one of the things that I'm sure Governor Evers would concur with is our schools are so important, our children are so important. We know this is a system that has been deeply disrupted during the past year. And so we're all eager first of all, we're very grateful to teachers who have found creative ways to teach in online settings and hybrid settings, and for those who have gone back into face-to-face settings with masks and social distancing and all of the requirements. They've done a fabulous job under their circumstances, and I know everybody is ready to get back to more normal educational settings. So it makes sense to me from a sense of protecting those who will provide education, and also because those educators will be in contact with a population of children that as of this point in time are not eligible to receive the vaccine. So it makes sense to us, and we will take that into deep consideration as we look at the entire recommendations from the group when they are forwarded to us within the next day or so. Dr. Westergaard, anything you would add, having sat on the committee?
I echo your gratitude and appreciation. My colleagues in that group really have done really heroic work. And one of the things that's really complex about it is, you know, our charge is it is acknowledging that our goal is to immunize everybody. We want everyone to get a vaccine. But in the era of scarcity, what is the most public health good that we can do with how we allocate our earlier rather than later vaccines? And the public health good can be defined in a lot of different ways. There's people who are most likely to die if they're infected, so that's why we prioritize elderly. And then there's all the ripple effects of the benefit in society of getting life close to back to normal. And schools as an area that's influenced really everyone in the community. So that was some of the discussion, some of the rationale of why that group seemed to be very important.
Thank you. Now to Ed Zagorski from the Watertown Daily Times. Ed?
Hello and good afternoon. For seniors 65 and up who have no computer and have been calling their health departments and are not getting a response, what do you tell those folks, especially when their own doctors and pharmacies don't know the answer of where they should go or when or how are they going to get the vaccine?
Well, what I would tell them is, first of all, it's going to take time and we need to be patient. Their doctors, their pharmacies will be getting vaccine if they request it. I think it's really important for us to remember how the system works. As the governor said, we've enrolled many, many more vaccinators. We're over 1,300 vaccinators across our state. And we encourage them to wait a week or two and call again. And I think they may very well get a different response as our vaccinators get ready to fully vaccinate this group. While we worked on giving advance notice to through member organizations like the Pharmacy Society of Wisconsin and the Wisconsin Hospital Association and the Wisconsin Association of Local Health Departments and Boards. We know it takes time for that information to disseminate out to all of their members. So it will be, those calls are helping those vaccinators understand how important it is now for them to make a request for vaccine. Some of them didn't make requests before because they weren't immunizing healthcare providers. They're community facing, like pharmacies, and they would only be vaccinating once a group in the community was ready. So many of them are requesting vaccine this week. We had double the requests for vaccine this week that we had last week. And so they're preparing, they're getting ready, they'll have vaccine on board. And so I would say to that person, give a call in another week or two to your pharmacy, to your healthcare provider, or to your health department. And I think you will get a different answer.
Thank you, Ed. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. I was wondering, DHS has talked about working on creating a centralized vaccine platform to register eligible individuals and connect them to vaccinators. Can you talk about where the state is with that platform and when do you anticipate it going live?
Yes, we're working with Microsoft right now to program the software and add all the questions and customize it for Wisconsin. We are anticipating doing our pilot testing of that the week of February 8th and having it widely disseminated the following week. Alongside that, we're working on our website. So as people are getting ready to hold community-facing clinics, we'll have a place on our website where people can call and, check on the website and find locations very similar to how we have a place on our website where you can find testing locations. So that work is underway. We know that, again, holding big community mass vaccination clinics is probably not going to happen until we have more vaccine. And so we'll be ready for that when more vaccine comes flowing into the state. We also know that there are some local communities across the state, either through healthcare, as the governor has mentioned, like Prevea Health with Dr. Rye, with some of our local health departments who are doing public-facing clinics already. Those early adopters are out there. And so again, checking with your local health department. Again, if you have access to the internet, doing that online is the most efficient way to do that. And in the interim, people can check with their local health departments or clinics for information in their community.
Thank you, Sean. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo.
Hi, thanks for doing this. Just kind of going in a little deeper to a previous question regarding the SD Max recommendation to prioritize teachers in phase 1B. I'm not sure if it's too early to say or if this question is for Julie or Dr. Westergaard, but when it comes to that point, what does prioritizing teachers look like when we get there? Thank you.
Hi, thanks for doing this.
So I think what prioritizing teachers looks like is a lot like what it looks like when you prioritize healthcare providers or when you prioritize police and fire, is that you will open up a number of avenues through which that group of folks can get vaccinated. So a couple of ways that planning is underway for that as well is, again, many places may do community clinics for teachers, educators, and I also want to include childcare workers in here. Again, our childcare workers, our daycare workers have been caring for our youngest children throughout this pandemic and are certainly included in this group. So we are working with a number of pharmacy chains to see if they would be willing to go into school districts, for example, and have vaccination day where they could do vaccines for all of the faculty and staff at a given school district. We know a number of health systems have been reaching out to school districts to talk about doing that kind of work. We know many of our local health departments work very closely with their school districts and have throughout this pandemic, and may be offering that service. It may be on site at the school, or it may be school staff coming to a location within the community. And alongside that, it can also be school staff seeking vaccine at the places that you would normally seek vaccine. They may go to their doctor's office. And what we'd say to healthcare providers as we move into these different groups, the question arises, well, how do I know you're a teacher? Or how do I know you're a police officer? And so we've told our vaccinators, ask people for an ID or a pay stub, or if they don't have either of those, if they will sign an attestation saying, I am Julie Willems Van Dyke and I teach for this school district, take my word for it. But we don't want to create great barriers for these groups to be able to get vaccine. The point is get vaccines in arms, and we also want to create systems for easily vaccinating large groups of people.
Thank you, Mary Jo. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline.
Hi, so you had mentioned that one of the reasons you have prioritized people 65 and up is because they're at greater risk of getting extremely sick or dying from the virus. But I'm wondering, why didn't SDMAC recommend then that people who are under 65 but might not be living in a group home setting but suffer from the same kind of serious health conditions, why they wouldn't be included in that group? And is the state going to follow SDMAC's recommendation to not include people with comorbidities, or could you still decide to include them in phase 1B? Thank you.
Dr. Westergaard, would you like to speak to that?
Yeah, I can speak to the first part about the deliberations. So the many considerations of what goes into the recommendations. Part are what does the evidence say is going to have the greatest impact, and the single greatest risk factor, single greatest predictor when you look at a population level of where our deaths have occurred is age. So that is the strongest signal, and it is also something that's very easy to implement. All you need is an ID to know what someone's age is. Now, that's not to say there are individuals who are younger than 65 who are at risk, but when it comes to feasibility of getting a large number of people immunized in the highest risk strata quickly and efficiently in a way that we can pull off, the committee felt that the feasibility concerns felt that using age alone as an indicator was the best recommendation initially. Acknowledging it's not perfect and that there are individuals at risk across the spectrum, but as a matter of policy, we need to do what we can do efficiently and effectively in the near future.
Thank you, Madeline. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose.
Hi, thank you for taking my question. Governor, President Biden just released a sweeping plan to help speed up the vaccination process, such as more funding to states, vaccination sites, and his goal to get 100 million shots in arms in his first 100 days. Do you think his initiatives will make a difference to help Wisconsin speed up the process here? Thank you.
Well, certainly all those things will help, but and I understand his goal to be 1 million per day for his first 100 days in office. But we do need more we do need more vaccine. All the other things that you talked about, they're great, and we want to make sure that we have the equipment, we have the folks ready to do that. But if we don't have vaccines, that's not going to help. So, but I will say that I know the president has talked about the 1 million per day goal, and I think as a country we can we can meet that. In fact, I think just this last week, I think we had 1 million per day someplace across the country. So I'm looking forward to what the federal government is going to provide. And I know that increasing production is a major goal of theirs also. So hopefully that will be forthcoming. Information on that will be forthcoming soon.
Thank you. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks for taking my question. Up here in Green Bay, the Green Bay Area Public School District has decided not to let kids back in the classroom until 3 weeks after vaccines are available for teachers as part of Phase 1B. My question to the health professionals on this call is when then, knowing that, do you think that Green Bay students will be back in the classroom? Thank you.
And I know you asked the health professionals to respond to this, but as I have said all along, that local school districts are the best to understand the mitigation strategies that are needed in order to have safety in the classroom. And so I'm not going to second guess when that will be, or those things. But you know, we've said there's 700,000 of us. I'm part of that category that are in this category of 65 and up. It's going to take time, and so by the time the Green Bay teachers are vaccinated, it won't be next week. That is for sure. And so it's impossible for us to guesstimate that. It depends on the, you know, if we don't get more vaccine, it's going to be a long time. If we do get more vaccine, that timeline will be shorter than what it would be if we didn't have vaccine. But for us to, at this point in time, make any kind of educated guess as to when we will be through with all the teachers in the state, and when 3 weeks after that point in time is something we just cannot make a logical guess or even an educated guess.
Thank you, Rob. Now to AJ Bayapur from WKOW TV in Madison. AJ.
Good afternoon, everyone. Thank you for doing this call. I've got a little bit of a two-parter here. One, the Federal Advisory Committee for the CDC a month ago almost had recommended that folks like grocery workers and transit workers be included in Phase 1B. So what was the reason for having it take this amount of time before it's formally part of the SDMAC's recommendations? And as far as the dashboard, if you could explain the difference between the total that has been allocated versus that which has been ordered, because some critics of the rollout so far are saying, why has the state's vaccinators only ordered 470,000 doses if the federal government has allocated about 780,000? Thank you.
Those are two questions, I think.
Well, I'll go ahead and answer the one about the allocation. So if you're looking at our dashboard, it's really important for you to add two numbers together. So there is the ordered number, and then you need to also add the 197,000 that have been transferred to the pharmacy program, to CVS and Walgreens, to vaccinate people in long-term care facilities. And when you add those and look at that minus the number of vaccines, you'll find there's about 100,000 doses there that it looks like we haven't ordered. Those doses were second doses that were added into the allocation on Sunday evening. We post that data on Mondays or Tuesday morning, I think, this week. And so they were doses that had just been added. They'll be ordered this week. So we are ordering the great majority of every dose that is available to us, and getting it out into the field for our vaccinators to vaccinate.
And I'll just cycle back and answer the question about why didn't our state committee make those recommendations on, say, grocery workers back then. Well, I suppose we could have, but we couldn't have got the vaccine into their arms. And so we have to be logical about this. And they make recommendations, we figure out the best time to do it. But even if when the CDC made those recommendations, and we said, yes, that's a priority for us, we'd still be doing people in nursing homes and assisted living and other folks that were a priority. So I just ask you to think about the fact that we can only vaccinate as many people as we have vaccine.
Thank you. Now to Patrick Marley from the Milwaukee Journal Sentinel. Patrick?
Hi, thanks for this call as always. I wanted to ask you, long-term care advocates have been criticizing the federal pharmacy partnership program for moving too slowly to vaccinate assisted living residents. We have about 70,000 residents, I believe. Advocates are calling on states to work more closely with independent pharmacies and others to speed up vaccinations of this population. What is Wisconsin doing to speed up vaccinations for people in assisted living facilities?
Well, thank you for that question, Patrick. So let me give you an update on the federal pharmacy program. In terms of nursing homes, we're nearly 95% of the way through the first dose. And so the pharmacies are finishing up those facilities this week. And according to the program guidelines, they are only beginning assisted living next week. Although I will report that they've already started in 52 facilities, because we said to them, if you have doses, and particularly if you're in a facility that has both a skilled nursing facility and an assisted living facilities, which many of our continuous care retirement villages have, you can certainly go ahead. One of the reasons that we're a bit behind here in Wisconsin is because we had to have a lot of doses in our bank in order to initiate that program. In order to initiate the assisted living portion of the program, we had to have half of the 140,000 doses that were estimated needed to care for assisted living residents and the staff in those facilities. So it took us a number of weeks to save up those doses, as we were also distributing for our healthcare providers and saving some doses every week to initiate that program. It appears from some of the data we've looked at that we may likely have more assisted living facilities than a number of other states. And that is probably why it took us a little longer to initiate that program. The other thing is we are also concerned about getting to assisted living, and we know we have, I believe, over 4,000 that are on the list. So we are working with Walgreens and CVS to transfer some of those, especially some of the smaller facilities, back to the state's responsibility. And we have had independent pharmacies raise their hand, as well as local health departments, and say, give us the vaccine and we'll go ahead and vaccinate our residents and staff in those smaller facilities. So we began conversations with Walgreens on this late last week. We're working on the transfer of vaccine in order to do that, and are with you and the advocates in how we can move this as quickly as possible to protect those people and assist both residents and staff in our assisted living facilities across the state.
Thank you, Patrick. Now to Stephanie Hoff from WIS Politics. Stephanie.
Good afternoon, and thanks for taking my call today. My question is for the governor. President Biden said he wants to open schools in 100 days, and SDMAC also indicated, while recommending prioritizing educators and staff, that schools need to return to normal because the next generation of Wisconsinites is suffering a youth mental health crisis. Governor, do you plan on taking any action on reopening schools for in-person instruction?
Well, as I said before, I have consistently throughout this pandemic relied on the local school boards to ultimately make those decisions, and wise decisions with consultation not only among the board members but also local public health officials, the teaching staff the staff that work in that school, along with parents. And for the most part, that has worked. And even though we haven't begun to, in a large way, vaccinate teachers in the state of Wisconsin, there's school districts all over the state that have been open through the entire pandemic in one fashion or another. And so those decisions will continue to be made. You heard earlier about a decision the Green Bay School District made and around that. And but there are other school districts that are opening without, have been open all along before the vaccines were ever available to folks. So I don't see this as being a statewide mandate, because every school district is different as its ability to mitigate, as its ability to keep kids 6 feet apart, all the things that are important regarding continuing to be safe and secure and healthy.
I think also, to Stephanie, this is Ryan Elston, is we're a local control state for education. These are decisions that local school boards can make. It's not an authority that the governor can order schools to open or close. You know, the Department of Public Instruction doesn't have that authority. The Secretary of Health Services can close schools as well pandemic, but cannot order them to open. So I think that's the other thing, to the governor's point, that not only are school boards in the best position to make decisions on when they're fully open or what type of model they use, but they're also the ones that have that authority and power to do so.
Thank you, Stephanie. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you very much. There are 2 assembly bills that prescribe a number of changes in the state's vaccine plan. One that would open up the vaccine to everyone 60 and older pretty much immediately, and to open it to the general public by March 15th. And there are several Senate bills. One would forbid DHS or local public health departments from requiring anyone to get the vaccine. One would forbid employers from requiring people to get the vaccine. And one would exclude prison inmates from being prioritized from the vaccine. And there are other bills that would require a supermajority of a school board to vote every 2 weeks to take a district all virtual, and one that would forbid closing houses of worship. Which of those bills, if any of them, would you sign? Which do you think you would veto? And in either case, why?
Well, you named a whole bunch of them there, and usually I don't weigh in on what I'm going to sign or veto before I even know if it's going to make my desk. Certainly, we worked with the Senate Republicans on several COVID-19 bills, and I'm willing to sign that. That was a really important piece of legislation. The Assembly doesn't seem to be in that position, even though for the most part, the parts of the bills that we agreed on with the Senate were bills that all three, the 2 houses, leadership and I had already agreed on. So it's premature for me to respond to a bill that many of those I don't think are ever going to reach my desk anyway. There might be good parts to it, there may not be. We examine them as they get closer to being passed by one house or the other.
Thank you, Eric. Now to Sierra Whaley from WJFW in Rhinelander. Sierra. And a reminder, *6 to unmute your phone. Sierra from WJFW. Okay, we have to move on then to Naomi Knowles from WISC TV News 3 Now in Madison. Naomi?
Yeah, thanks for taking my call. My question is, what information does the DHS have or is collecting about rates of wastage right now from vaccinators? And also, what do we know about rates of cancellations or declining vaccines? Thank you.
We ask all of our vaccinators to report any waste or loss of vaccine to us. Of course, early in our vaccine journey, we had the unfortunate loss of 500 doses in the Grafton pharmacy from the pharmacists who deliberately left those vaccines out. Beyond that, we've had a very low level of lost vaccine across the state. There have been a couple of incidences of a few vials lost that were left out too long. There are very strict rules around how long these various vaccines can be left out of refrigeration. And was one report of a lost vial in transport, but it's been very small, only a few vials. And this is what I understand has happened nationally as well. Our vaccinators understand this is a very precious resource and that we need to get every dose in people's arms. And so they have been treating it as such. And I'm grateful we've had minimal loss and similarly across the nation.
Thank you. Now to Elise Ramos from NBC 15 in Madison. Elise? NBC 15? Okay,
Hey, sorry, I had a problem. You've been talking about how you haven't had enough vaccine and that's been holding you back. Especially you had mentioned some, I guess, confrontations with the Trump administration, but now that the Biden administration is in there and they have implemented some of those orders, I'm just wondering, what are you going to do on the state level to maybe fix that, to find those vaccines, and how are you guys going to work with this new administration to get that done in Wisconsin to fill those gaps?
Well, we're going to continue to work with this administration like we did with the last one, and that is the amount of vaccine that comes into the state and is available to put into people's arms is solely a federal solution. And if the president is unable to make this happen, we will work with them as best we can to make sure that the pieces are in place. We just need some real transparency around this from the federal government, and thus far the federal government, the new administration has been transparent around this. So it's my hope that the president does everything in his power to increase production so that we can get more vaccines into people's arms. We do not create vaccines in the state. This is a federal responsibility, and we have expectations that if we want to do this as quickly as possible, we need to have more.
Thank you, Elise. Now to Adam Rogan from the Journal-Times in Racine. Adam.
Thanks as always for having this call. Kind of jumping off what somebody asked earlier. But at the end of the day, for the different vaccinator sites, when there are quote unquote extra vaccines available, are they able to be, like, what happens with those? Are they able to be stored again? Are they opened up to different members of the public, like we've seen in New York City, where there's kind of rushes for the end of the day doses that are left over when the people who have been allotted them haven't even vaccinated, or do they have to be disposed of, or can they be like refrozen? What happens?
Great question, and let me explain what happens. First of all, once you've opened a vial and reconstituted it, you cannot put it back in the refrigerator or the freezer. You have to use all the doses in that vial. And so if you're getting to the end of the day and you have some vials with unused vaccine, what we have asked our vaccinators to do is find someone who wants the vaccine and get it in their arm. You know, preferably someone who's in one of the eligible groups, but if that is not possible, look around and find someone who does want to receive vaccine. We do know there are some healthcare systems who are keeping a waiting list of people who want to be called if there's extra vaccine at the end of the day. Other places are calling other providers. I know, for example, some systems early on would call police and fire because they knew they were going to be coming next, and they'd say, hey, we got 5 vaccines. If there's some folks in the fire station who want to come down and get them, come get them. And so each vaccinator is doing that different ways. That is sometimes why you hear about people who would not normally be in one of our eligible groups receiving vaccine. But as we said, this is a precious resource. We don't want any of it wasted. It is a very fragile resource. It is very hard to predict exactly how many vaccines you're going to use in a day. This is not like most of our other childhood vaccines that you just take them out of the fridge when you need them and put them back. You have to be very precise about how many people you're going to vaccinate that day, how many doses you're going to take out, and they're multi-dose vials. So, you know, sometimes you've got a 5 or now a 6-dose vial because Pfizer has said that there are actually 6 doses in each of their 5-dose vials. And you've only got 3 people left at the end of the day. You need to find someone to use those last 3 doses. So that is exactly the guidance we've given our providers, and we've said absolutely don't throw it in the garbage with a viable dose in the vial.
Thank you, Adam. Now to David Wahlberg from the Wisconsin State Journal. David.
Yes, thank you. Governor Evers, given that you are in the 65 and older group, when and where do you plan to get your vaccine? And also, why not set up a lottery system or some other mechanism of sort of distilling this large group of 700,000 people to more, to meet the supply, the much smaller amount of doses available?
Well, I'll just, there's actually 2 questions. I'll let Julie answer the second part of the question. We will get our vaccine when our primary health physician contacts us, and we'll make an appointment. That's the way it's going to work in our household, and my guess is that's the way it's going to work in many households across the state.
And in terms of doing a lottery statewide, we don't have a statewide health system. We are, as Ryan Nilsson said earlier, we have local control. We're a home rule state, and so we have a locally controlled public health system as well, too. So there's really no mechanism for doing a statewide lottery system. One of the things that the State Disaster Advisory Medical Committee has provided for our healthcare providers, our local health departments, is some thoughts about how within their own patient population or within their own community, they might think about distributing vaccine. And it sounds like perhaps Governor Evers' provider has done such an assessment. It may be through a lottery. It may be through it sounds like either through lottery or through identifying people who are even more at risk. Some providers may assess people with other diseases who put them doubly at risk. They're older adults and they have other diseases like heart disease or lung disease or diabetes that put them even more at risk, and maybe doing those populations first. So each provider is doing some of that triaging of how they want to bring patients into the clinic. The SDMAC has been helpful in helping guide vaccinators and how they think through that.
Thank you. Now to Natalie Sopola from WAOW TV in Wausau. Natalie.
Hi, guys. Thanks for doing this. This is sort of a follow-up question to one that was previously asked about bills. I just wanted to know your guys' general response to these bills, considering that they are coming out of criticism from Republican lawmakers about the vaccine distribution thus far.
Well, I'll respond to that. And yes, they are from folks, some of them are from folks that are critical of our response. We're doing the best we can. And legislators can do what they want to do, and if they want to make a political issue out of this, they can make a political issue out of this. It's interesting to me that they haven't done anything in COVID-19 for weeks and weeks and weeks and weeks. And now when we're in the midst of actually solving this problem, we're having people develop bills that could be viewed as critical. Frankly, that's what, whatever they do, they have to do. And so we will continue to spend our valuable time continuing to do what we want, that we feel is important, and that is to get shots into people's arms.
Thank you, Natalie. And we have time for just a few more questions, and we'll continue now with Susan Benz from Milwaukee Public Radio. Susan?
Okay. Excuse me, I'm sorry, we missed the first part of the briefing. So if you've stated this, I'm sorry. But when does DHS plan to make a decision on who will be included in Phase B beyond those who are 65 and older?
We'll receive the final document from the State Disaster Medical Advisory Committee in the next day or so, and we plan to make a decision by early next week.
Thank you, Susan. Now to Kent Wainscott from WISN TV in Milwaukee. Kent.
Hi, good afternoon. Thank you. My question is for Governor Evers. We're marking an anniversary of sorts. It's a year since most of us first heard about the first cases of COVID in the U.S. and the first cases in Wisconsin shortly after. As you reflect back on this past year, is there something that you wish you or the state had done differently?
Well, I think it's a bit early, frankly, to start an analysis of that. But certainly, I feel that considering that we had Republican opposition and court opposition to any kind of mitigation of the disease, except for a period of time where we were able to require people to wear masks, I think that put us behind the 8 ball. But I do think that we came back and did a great job of testing and tracing and making sure that we continue to talk about the important things that we couldn't mandate, and I think people responded well. Just to go back in time, we had a safer at home order that actually saved lives. So there's plenty of research that suggests that we do that. Do I think I wish that we had a better unemployment insurance compensation system so that people didn't have to wait as long as they did? Absolutely. Obviously, that's been known for a decade or more, but I think it's really important as part of the recovery of from this pandemic that we give people the financial resources that we can. I think we did a great job at distributing the money. Did we do anything significantly wrong along the way? I guess if you ask some of my Republican friends, I'm sure they could point out those sorts of things. But given the circumstances of the pandemic in the state of Wisconsin, we did the best we could under the circumstances that or the hand that had been dealt us, especially as it relates to the Supreme Court.
Thank you, Kent. And that will conclude today's briefing. For more information on COVID-19, please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.